Good afternoon and welcome to the third floor conference room of Waco City Hall. I'm Larry Holsey, Director of Municipal Information and Communication for the City of Waco, and I'm going to be the moderator for our 13th consecutive weekly press conference, receiving information from our mayor, our county judge, and Dr. Griggs. We're glad that you're here. Down in our studio, we have our American Sign Language interpreter as well as a full translation being recorded in Spanish. And again, so graciously, probably gracefully too, for that matter, joining us is Councilmember Hector Sabito, who will introduce and invite our Spanish-speaking viewers to watch the replay of this particular press conference in its entirety in Spanish, starting at 4:30 this afternoon. Councilman Sabito.
Thank you, Larry, so much. Para ayudar a nuestros ciudadanos que hablan español a saber lo que se dice durante esta conferencia de prensa, un traductor está grabando una traducción en español en vivo durante esta conferencia de prensa. Esa grabación completa en español reemplazará el sonido del inglés en el video y una versión en español de toda la conferencia de prensa se reproducirá en el canal de cable de la ciudad de Waco aproximadamente a las 4:30 de la tarde. Puede ver la conferencia de prensa en el canal 10 o por internet en vivo en wccc.tv. Larry, thank you so much.
Thank you again, as always, Hector. Councilman Sabito, should I say. I just want to let everybody know that we are social distancing, even though we're in a small room, but we've been all wearing our masks up to this time. I'm taking mine off because I'm more than 7 feet, probably 8 feet at least, from anybody nearby, and I want to make sure you hear everything clearly. But it's very important, and we'll be talking about that today. I'm going to outline how we're going to conduct business today. We'll do it as we've done it in the past. We're going to open up with opening comments from our three specialists and our guests. Then we will I'll present questions that I have received and collected through the help of a lot of people through the community. And then following that, the mayor will open it for questions by the phone, which we have representatives from 2 media locations, and then we'll have closing comments. And let's start with opening comments, start with the mayor, followed by Judge Felton, and then Dr. Griggs. Mayor?
Thank you, Larry. I'm going to call a little bit of an audible here and ask Dr. Griggs to go first, because the main news today is the increase in positive tests over the last several days. So I'll ask Dr. Griggs to go first, and then Judge Felton, and then I will have a few things to say. Dr. Griggs?
Great. Thank you. As we experience this steep climb in active cases of coronavirus in our community, I really have 2 points I want to share. The first is that ultimately this is not about the numbers. It's not about an abstract idea. We're not fearing some unnamed lurking pestilence. What our community is experiencing is a known virus with specific characteristics of transmission and particular behaviors that we have an option to either enact to invite or to limit the spread of the virus. And these health behaviors, how we live collectively as a community, our actions will determine how many community members get infected, how many of us are hospitalized, and ultimately how many deaths we will have from COVID-19. So when we say that we are in this together, we are speaking both of compassionate alignment, but we're also speaking something of scientific fact. Second, the notion of pandemic taps into some deep fears among us. People we know are now getting infected. Without level heads and emotional sobriety, we risk reverting to tribalism or anger or resignation. And so now is the time for our best selves to show up. for us to all listen to our own emotions, to be vulnerable with those that we trust, to live consistent with our values, to love our neighbor as ourselves. Clear thinking, emotional health, and action that aligns with our values will win the day. I'd like to share with you now numbers, remembering that these are human lives we're talking about. So worldwide, over 9 million confirmed cases and 478,000 deaths. In the United States, we've had 2.3 million cases of coronavirus and 121,000 deaths due to COVID-19. The Texas Department of State Health Services indicates that we've had 120,000 cases in Texas, which has doubled from 2 weeks ago. We've had 2,200 deaths in our state. The effective reproduction rate, that's the RT that we've been talking about, is 1.18. Remember, the goal is less than 1. In Texas, the hospitalization rate right now is 8.6%. So that means of confirmed cases, 8.6% of those have been hospitalized. And the number of patients hospitalized with the virus in Texas has doubled over the past 3 weeks. The positivity rate across the state right now is 9.8%. So now information from McLennan County, and this is updated as of this afternoon. The total number of confirmed cases is 473, 293 of which are currently active. As of this afternoon, the Public Health District has received notification of 52 new cases of coronavirus. There are currently 13 hospitalized patients with COVID-19. 5 of those patients hospitalized with COVID-19 are currently receiving ventilator support. We've had a total of 6 deaths in our community due to COVID-19. The health district is monitoring 556 individuals, which includes positive cases and their close contacts. And to date, of those who have been receiving daily monitoring by the health district, over 50 individuals have become positive, highlighting the importance of the work that's being done by the epidemiology team. The total tests completed on McLennan County residents is 14,655 tests. I believe that momentarily the mayor will be speaking about positivity rates in the county, but I wanted to mention we've been tracking our rates at the Family Health Center, have seen a steady rise in the last 2 weeks in positivity rates. Right now we're around 12%, which is higher than what we want to see. We are strongly encouraging all of those who have even minor symptoms that may be attributable to COVID-19 to come in so that we can evaluate and perform testing as is needed. Both hospitals have ample capacity to manage COVID-19 cases in the immediate foreseeable future. Their total capacity continues to be 96 total ICU beds and 441 total hospital beds. And neither of our hospitals have taken on new patients from larger counties. There have been a total of 3 positive cases at nursing homes in McLennan County, but no new cases within the past week. There are 2 recently reported cases from the jail among staff members, one of whom was asymptomatic. And we were just moments before the press conference began, we were notified that the health district will be arranging for testing of all inmates and staff at the jail. So the the summary from my vantage point, we are seeing a dramatic spike in cases, particularly among individuals less than 65 years old. The spike is not surprising, but is predictable from principally the important easing of economic restrictions, but also from indoor gatherings and unmasked clusters of people. The absolute case counts at this point has not outstripped our hospital capacity or our health district's ability to perform contact tracing and monitoring. But if the rate of rise continues unmitigated, we will be overwhelmed. There's an expected delay of 3 to 5 weeks following widespread community behavior change before obvious rate changes in new cases and hospitalizations, meaning now is the time for our community to act to prevent a July disaster.
Thank you, Dr. Griggs. Dr. Felton, Judge Felton. I've done that before.
That's fine. Well, obviously, we've got our guard down in regards to trying to stay safe and healthy. And I think, and somebody mentioned it before, quarantine fatigue may be part of it to a certain extent, but it appears that that people are not adhering to the guidelines that have been in the past. So there's a lot of work to be done, and it all starts with ourselves. It's an individual responsibility. In regards, the city, of course, has had it harder out with certain stipulations to businesses, as well as the city of Waco plus Hewitt and Woodway. The county at this time is not issued an order, but has been in close contact with the other cities and the mayors and the city managers of the other communities. And I'm told that a high percentage of the businesses in their area have been adhering to wearing masks on the job, asking their people to, but not under an order, more under a volunteer side. If you take the city of Woodway, Hewitt, and Waco, that's a little over 60% that are under the order of the population, and a higher percentage, maybe as much as 80 in the businesses. So the commissioners will take under consideration the order next Tuesday, which is our regular scheduled meeting, but have been encouraged by the reports getting back to the city how their communities reacting to this. I can tell you, and I feel confident speaking for the commissioners and myself here in McLennan County, that we highly encourage people to adopt the CDC guidelines, which includes, and very important, to wear masks when they're in places of a high concentration of people, and their 6 foot social distancing is not possible. And as well as the other guidelines that require, that ask you to wash your hands frequently, and mainly stay healthy and try to take care of yourself. A lot of this we're finding happens in a family setting, and so just remember, when you're off work or you're away from whatever you do every day, the coronavirus is still out there. It's at your home, it's at your business, it's on the way back and forth, and we just can't let our guards down. Families be especially conscious of when you have family members that really can't stand up to any kind of disease without having problems, and especially people that are in my age group, 65 and older, and I'm older than 65, but there's a lot of risk there. So be sure it's my responsibility to know what my family's doing and where they've been before I see them, and it's their responsibility to be careful when they come to see me, in the same way, and everybody else's family as well. So So with that, Mayor, that concludes my remarks.
Thank you, Judge Felton. We are at a very serious point in our community's fight against the COVID-19 virus. I want to show you a few slides to illustrate that. This first slide is the slide that we always talk about, which is the McLennan County total cases, showing new, cumulative, active, and recovered. That orange line, the darker orange line, is the cumulative cases. For nearly 3 months, our community managed to keep this virus at an extremely low rate. We had our first confirmed cases in McLennan County on March 17. We registered 6 that day. We did not reach 100 total cases in our county until May 20th, 65 days later. We didn't reach 200 total cases in our county until June 17th, 28 days later. We topped 300 total cases in our county on June 20th, just 3 days after we had gotten past 200. And we topped 400 total cases in our county yesterday, just 4 days after we reached 300. So we do have now exponential growth in our community, and that's what is so very concerning. This is hospitalization, and you can see that we are now at 13 hospitalized patients. Dr. Griggs mentioned that earlier. We have not approached that up till now, and those numbers are unfortunately trending up. The positivity rate in Texas, this is the 7-day rolling average that we always show. You can see that it is, the last count was about 9% and trending higher. We don't usually show this next slide because this is the daily rate that without averaging. We don't usually show it because it tends to bounce around a lot, but in a time like this, when it is trending solidly in one direction or another, it can give you a better idea of what's happening. And you can see that it is just under 10% and has been climbing steadily for the last several days. This is the McLennan County's positivity rate on a rolling 7-day average. Unfortunately, because of some reporting issues, we're about a week behind on this, and we've got to get that information caught up, and we are working on that. But we believe, based on some other calculations, that our actual rate is probably about 10% now. Dr. Griggs mentioned that the Family Health Center's rate is at 12%. That is a significant change over the time when we were back in May under 0.5% on that average. This is another slide that I want to really talk about in terms of our positivity. In terms of our trend. This is the active cases. So these are patients who are currently sick with the disease. They haven't died and they haven't yet recovered. In early to mid-May, we were experiencing less than 10 active cases on a daily basis for over 2 weeks. In late May, we were seeing 10 to 12 active cases per day. Then from June 8th to June 11th, in 4 days, we doubled that number of active cases from 12 to 24. From June 11th to June 15th, in 5 days, we doubled the number of active cases again from 24 to 49. From June 15th to 18th, in 4 more days, we more than doubled the number of active cases again from 49 to 105. From June 18th to June 22, in 5 more days, we doubled the number of cases again from 105 to 221. As of yesterday, we were at 243 active cases. This is, again, exponential growth, and this is what has occurred in many places around the world that has ultimately led to overwhelming the hospitals. As Dr. Griggs mentioned, our hospitals are not close yet to being overwhelmed, but it is this rapidly rising trend that gives us all concern. So, what can we do? We can do the things that we've been told to do by President Trump's team of experts, by the CDC, by the Texas Department of State Health Services, by our governor's team of experts, and by our own local doctors and health experts. We should stay at home as much as possible. We must maintain a physical distance of 6 feet or more from anyone who's not part of our own household. We must wash and sanitize our hands frequently and not touch our faces if our hands haven't been recently washed or sanitized. And we must wear masks or face coverings. Masks and other face coverings have been demonstrated to be effective. A study out of Texas A&M with contributions by University of Texas last week is one of the latest scientific studies to demonstrate the effectiveness of wearing masks in public. The Texas A&M study's conclusion is that wearing a face mask in public corresponds to the most effective means to prevent interhuman transmission. The study went on to say, this inexpensive practice in conjunction with social distancing and other procedures is the most likely opportunity to stop the COVID-19 pandemic. Our work also highlights that sound science is essential in decision-making for current and future public health pandemics. I couldn't agree more. I am not a health expert, but we have great health experts that we are consulting with on a daily basis about what we do. And that was the basis of our decision, my decision last Friday, to issue the order requiring face masks in businesses. Beginning on April 27th, when Governor Abbott issued his executive order, GA-17, mayors and county judges have been completely stripped of any local control to combat COVID-19 in our communities. Then last week, the governor explained that we had permission to issue local orders mandating that businesses require face coverings when they cannot ensure that their customers and employees can maintain adequate distancing. Bexar County issued their order first, followed quickly by Dallas County and others, and then we issued our order on Friday afternoon. I know this is not popular with many of you, and I'm sorry about that. We have to follow the science and do everything we can to stop this rapidly rising disease in our community. So I ask that you be patient and recognize that when you wear your mask, you're protecting the others around you. And the only way that we can achieve a lower transmission rate is if everybody in a closed environment is wearing a mask to protect each other. With that, I will close and turn it over to Larry for questions.
Okay. Thank you all very much. The first three questions actually are dealing with contact tracing, and I'm kind of going to merge the first two together. Are you satisfied with the amount of contact tracing locally throughout the pandemic? And has contact tracing been effective in tracing the source of the recent rise in the number of cases?
Dr. Griggs, can you speak to that? Oh, you're on mute, Dr. Griggs.
Thank you. So I think this